people all going in to one indoor space and having to deal with each other for 8 hours, 10 hours, however many hours a day. In those settings, the combination of the environment and the people that are in that environment create a risk, I would think, I mean, tell me if I'm wrong about this, I would think that workplace risk is about the greatest,
So, meine
least
Lieben, ich
controllable
höre gerade,
risk
wir
with
sind live,
respect to
aber ich kann
COVID
es noch
that
nicht
any
nachvollziehen,
person
weil ich
has.
das
You know,
YouTube-Studio
everything else a person can
noch
control.
nicht
You can
gesehen
go to the
habe.
baseball game or not go to the baseball game. You can decide who to go to the baseball game with. But you can't do any of that in workplaces. You have
So, jetzt wollen wir noch mal schauen. Ja, das ist nicht so einfach. Meine Lieben, das ist jedes Mal ein Ding, weil wir wissen ja nicht immer, ob wir von YouTube gesperrt werden, ob was da auch immer passiert. Ich sehe auch kein Screen-Sharing hier. Also es ist wirklich ein Durcheinander wieder. Ich sehe auch kein Screen-Sharing hier. Also es ist wirklich ein Durcheinander wieder. Ja, es ist ein Durcheinander jetzt wieder geworden, meine Lieben. Tut mir leid. Ich kann auch die Übertragung nicht hier sehen. Ich sehe auch keinen Screen. Es ist immer schwierig, wenn man von Kolumbien aus über Amerika nach Deutschland überträgt. Also es ist wirklich ein Durcheinander. Ja, es ist ein Durcheinander jetzt wieder geworden, meine Lieben. Tut mir leid. Und ja, dann sagt mir mal Bescheid, wie es funktioniert. Ich schalte mich wieder ein zum Supreme Court. Wie gesagt, es tut mir leid mit der Technik, dass das nicht geklappt hat. Ich hoffe, ihr könnt jetzt
unfortunately, Your Honor, it's going to, Mr. Chief Justice,
mitkriegen und sehen.
unfortunately, Your Honor, in this case, it's going to devastate local economies. It's going to decimate these local towns that don't draw their pool of applicants from the coast, Your Honor. These are local communities. They run these hospitals. And that is the problem here, Your Honor, is those kind of interests, that perspective was not heard in this context, and that is going to be devastating, Your Honor.
Justice Thomas, anything further?
So, ich glaube, ich habe eine Nachricht, dass ihr mich hören könnt, ja?
Justice Kagan?
Mr. Rossetti, this rural hospital question, you've presented some declarations that suggest that there would be labor disruptions. The Secretary took that into account specifically. Basically has a different view of the size of the disruptions based on the data that he had. And then in addition to that, said that there are countervailing things. There's countervailing things with respect to the labor force.
So, ich mache nochmal eine kleine Probe und will mal sehen, wie das mit dem Ton aussieht. Es ist immer schwierig, meine Lieben, von Kolumbien aus über die Vereinigten Staaten nach Europa zu übertragen. Das ist nicht ohne technische Schwierigkeiten. Hier ja auch. Und ich will mal sehen, wie das mit dem Ton aussieht. Ja, ich höre, dass der Hinterton noch etwas zu laut ist, dann werde ich den etwas leiser machen. Ohne technische Schwierigkeiten. Und ich will mal sehen, wie das mit dem Ton aussieht. Ja, ich höre, dass der Hinterton noch etwas zu laut ist, also werde ich den etwas leiser machen. Ohne technische Schwierigkeiten. Ja, ich höre, dass der Hinterton zu laut ist, also wenn ich etwas leiser mache. Ohne technische Schwierigkeiten. Ja, meine Lieben, ein bisschen zu den Details hier. Also wir wissen, dass seit etwa September letzten Jahres diese Anordnungen rausgegangen sind von der Biden Regierung, dass man unbedingt die Mandate herausgegeben hat. Man will die Arbeitgeber, also die Unternehmer dazu verpflichten, dass sie ihre Mitarbeiter dazu verpflichten, sich entweder impfen zu lassen oder sie müssen täglich einen Test beibringen. Der Hintergrund ist die Impfung. Man möchte die Leute dazu zwingen, regelrecht dazu zwingen, dass sie sich impfen lassen. Und das ist natürlich ein Problem auch für viele Arbeitgeber, also für die Unternehmer, die jetzt viele Kündigungen bekommen haben und wo es auch kostenaufwendig ist und so weiter. Also ein Riesenproblem. Dann haben sich zig Anwälte zusammengetan, über das ganze Land verteilt in den Vereinigten Staaten und sind in verschiedene, das geht ja seit September schon so zu, in verschiedenen Gerichten aufgetreten. Das ist dann zu einem Durcheinander geworden, wo einige Gerichte entschieden haben, dass der Präsident nicht das Recht hat, solche Mandate herauszugeben. Das wurde dann in Berufung gegeben und jetzt muss der oberste Gerichtshof, der Supreme Court, einschreiten und muss darüber argumentieren und eine Entscheidung treffen, um Ordnung in diese ganze Sache zu bringen. Das ist ein sehr polemisches Thema, wie ihr wisst, und sehr problematisch, weil es mit Grundgesetzeinzügen oder Verfassungseinschränkungen der Vereinigten Staaten, genauso wie auch in Deutschland, dieselben Probleme auftreten. Nur scheint die Justiz in den Vereinigten Staaten etwas konsequenter zu sein als die in Deutschland. Und jetzt müssen wir mal abwarten, was hier alles kommt. Ich bin kein ausgebildeter Jurist, ich habe auch kein Jura studiert, meine Lieben. Insofern werde ich das nicht Wort für Wort wiederbringen können, denn vor allen Dingen ist das auch sehr, sehr lange und sehr, sehr ausgedehnt und detailliert. Und da kommen Gesetzeszitate ins Spiel und sogenanntes Case Law, das heißt also, wie andere Gerichte zuvor entschieden haben und so. Und deswegen werde ich jetzt versuchen, hier eine Darstellung reinzubringen, dass wir wissen, in welche Richtung das geht und welcher Richter gerade seine Fragen stellt oder von dem Antragsteller befragt wird. Darum geht es jetzt. Und so, wir sehen jetzt schon, wie sich die Richter aufteilen in Gruppen, wo die einen Richter dafür und dagegen sind. Wir haben also jetzt schon verschiedene Sachen so mitbekommen.
Appear to support the Secretary's the CMS regulations. So I want, and the government makes something of that. What are we to make of that?
Your Honor, certainly there are large institutional providers that may have no problem with this. Obviously, there are smaller ones, very small community hospitals that do have a problem with that. But here, the states have their facilities. The
states have a very small percentage of the facilities. Most of the facilities are private-run facilities, right? This picks up on Justice Thomas's question, like where are the regulated parties complaining about the regulation? That's how we usually have. The last case is a good example, obviously.
Sure.
There's a missing element here.
Well, they're not certainly these sort of entities that would be subject to this rule, like small private facilities that receive Medicaid funding, certainly are not plaintiffs per se, but the states do represent the citizens of our constituencies, like these places that run these facilities, these small community hospitals. We speak on their behalf. And all I would say here is we have made value judgments through our policies to not require vaccination because a one-size-fits-all requirement does not help. And that kind of policy judgment, as expressed through our laws, are duly enacted laws that would be applicable both to state-run facilities and private facilities. That is what's being preempted here, Your Honor, by this unlawful mandate. And that's how we're speaking in that capacity here, Your Honor, is the folks whose voices were ignored throughout this entire process and shouldn't have been ignored, especially with these devastating consequences.
And then second, just I think you've alluded to this, but how is a vaccine different in kind from your perspective from, say, the requirement to wear gloves or the requirement to wash your hands or the other kinds of requirements? Because I think if you acknowledge that there's authority to require the latter, then you need to explain why the vaccine's different.
I don't think I could say it any better than Chief Judge Sutton did at page 12 of his dissent in the OSHA case, which is Masks can come off, gloves can come off. A vaccine requirement, the taking of vaccine is a permanent medical procedure that cannot come off after work is over. That is, there are materially different conditions, materially different procedures at stake. And when you look at the context, for example, in the hospital requirement, 1395.
Der Richter fragt jetzt, wo ist der Unterschied zwischen dem Mandat, dass man Masken tragen soll, dass man sich die Hände waschen soll, diese ganzen Dinge im Vergleich zum Impfen? Die Antwort ist, wenn man geimpft ist, dann ist der Stoff im Körper, den kann man nicht mehr rausnehmen. Die Maske kann man auf und runter nehmen, die Hände kann man sich waschen oder nicht waschen. Aber einen Impfstoff kann man nicht mehr aus dem Körper zurückholen. Die Frage hier ist nicht, ob es um das Impfen geht oder nicht um das Impfen geht. Die Frage ist, ob der Präsident die Macht hat, so ein Mandat auszuführen. So ein Mandat wurde noch nie von einer Regierung ausgesprochen in der Geschichte der Vereinigten Staaten. Und der Court sollte darüber entscheiden, ob der Präsident der Vereinigten Staaten hat die Macht, so ein Mandat über das ganze Land herauszugeben oder ob dieses Mandat von Kongress, von den Gesetzesmachern, von den Gesetzesentwerfern, die dazu berufen wurden, ob sie die Richtigen sind, die so ein Mandat herausgeben, aber nicht der Präsident. Das Gericht sollte die Regierung zurückweisen in ihre Schranken und zeigen, dass vom Gesetz her der Präsident diese Macht nicht hat. Wir haben jetzt den obersten Richter Thomas. Thomas ist Afroamerikaner, er ist ein Schwarzer, er ist seit 25 Jahren, über 25 Jahre, ich glaube es sind schon fast 30 Jahre, dass er im Amt ist.
So we have enormous interest in the way these programs operate, and that's one of the reasons why there are express consultation requirements built into the statute.
Thank you.
General, do you agree with the district court's statement that COVID, this is a quote, COVID no longer poses the dire emergency it once did?
Your Honor, I think that is those are shifting sands. Obviously, COVID conditions can change at any given time, and they have.
agreed to, which authorized the Secretary to impose requirements that the Secretary finds are necessary in the interest of the health and safety of patients. Why did that not give you adequate notice that something like this could be enacted?
I don't think that gave us any more notice that that could be enacted than, I mean, no one even expected COVID, so how could we possibly have expected to have the federal government, through a spending condition imposed upon us years after this program was created, co-opt a quintessential state police power for deciding whether its citizens should be vaccinated or not? That's just not something that we could have reasonably anticipated, given the general broad language that is put into the statute. And again, I don't think that their primary role is to actually provide directly for the health and safety of the people. It is to provide funding to the states to implement these programs, or through Medicare to reimburse for health care to individuals. Looking at that in terms of the discretion that you give, and when you evaluate whether this is a question or an issue that falls within the general discretion and scope that was granted earlier by Congress. And here there are multiple cues that conflict directly with the broad scope and grant of authority that they're claiming here.
Do you think we need to find that you have parens patriae standing in order to take into account the interests of employees within your state who do not want to be vaccinated? Is that a standing question, or is it a question that can be taken into account in the context of determining what the statute means and whether it satisfies whatever requirements there may be under the spending clause?
I think it's both. I mean, I certainly believe that you can take it into account as part of our standing. We have independent grounds for standing. When you get past that question, I think it also relates to the question of whether it's actually controlling the tenure of employees. I think it directly conflicts with that. I mean, Justice Alito, there's really no question, I think, in our mind that this was a pretext, that the entire, as the Chief Justice alluded to, that this was a workaround. This was an intent. The government intended to tether all of these restrictions together, all of these mandates together, to vaccinate as much of the American public as they could touch. And in this particular rule at the Federal Register 61607, the government even acknowledged that the most important inducement here was the fear of job loss. This is targeted at people. It's not targeted at facilities. And they've never done anything like this before, precisely because there are structural prohibitions against it in the statute. And where we are in this procedure is extraordinary. They want you to dissolve an injunction, parts of which have not even been contested, so that they can upend the status quo, which will disturb enormously our provider network.
Well, all that's true, but I'd like to get your response. I mean, there's some truth to what you say, but I'd like to get your response to what I asked previously twice, really. We sit in both these cases something as the inheritor of a court of equity, and we do that particularly in respect to stays, whether you call them administrative or not. That may be both sides, and in the other case, you know, that's why I say the side in each case that is predicting harm if the agency rule goes into effect. And the other side predicts serious harm if the agency rule does not go into effect. And as you heard in the OSHA case at the last minute, on the one hand, if they have to start complying with this, they have to get plans and the employers are hurt. On the other hand, if they don't start to get those plans ready, looks like a lot of people will get sick and take up hospital beds or worse. So in weighing those equities, why don't we have to take and put quite a lot of weight on avoiding even by a minute or a second? Because if you divide 750,000 by the number of seconds in a day, you get a lot of people. And why do we not have to take those things into account, see how the government would balance them, see if that is reasonable, and be very wary at the least of interfering with rules that will, in fact, save people's lives or hospital beds or from getting the disease? You see what I am saying? I'm asking, I'm putting a burden on you to say, yeah, that's what I am.
I do.
I want to know.
I understand the question.
Yeah.
I think, first of all, these aren't just plans. Here, this rule is different. There's no test and mask exception. This is a vaccinate, and it's a short shot clock. And so they do not have a choice. They have to be fired or they cannot be hired. And so it handcuffs our providers in a way that is extraordinary and immediate. And the status quo right now is that they still comply with all the other rules of Medicaid and Medicare, which means they have infectious disease control measures in place. They are doing the very best job that they can. They need all the boots on the ground that they can get, and this rule will actually change that. It will immediately change that. So I think it is extraordinarily different, and it also comes up in a different context. It comes up in the context of a preliminary injunction, multiple injunctions, but specifically in ours, where they did not even contest certain aspects of it. So they present to you a request for a stay that does not even contest certain aspects of an injunction that they want you to overturn.
Thank you. Thank you.
Counsel, I'm having a very hard time trying to do this state power argument with respect to a standing clause program that doesn't affect the states directly except as proprietors. Because as proprietor of state-run facilities, those are the ones that are affected by this rule. The private facilities are, and as one of my colleagues noted, Justice Kavanaugh, we don't have many amici of them complaining. But putting that aside, I am having a hard time understanding how and why a rule like this is so substantially different than the volumes of rules that CMS has with respect to so many issues involving health and welfare. They tell you how high the bed has to be. They tell you how close hand sanitizers have to be. This is before COVID. They have so many different rules that one could arguably say belonged within the state's rights that give me a working principle that says to the federal agency charged with the health and safety of patients, who believes that the only way to protect these vulnerable patients is by this one tactic, by this one step, why that should tie their hands. You may argue otherwise, that the other ways of doing it are effective, but they've decided in this particular context, with the vulnerability of these particular populations, that the other steps are inadequate.
Your Honor, there's two aspects to your question, and I'd like to speak to both of them. One is the issue of whether we're just proprietors. We are not just proprietors. And I think the court effectively discussed that in NFIB versus Sebelius. Medicaid is an enormous program where states are contracted with the federal government, not providers. The providers are contracted with the states. So it is important, I think, to keep that distinction between these two programs. To your question about the dividing line, the dividing line here is precisely why we are in a question of major questions doctrine land, because they have never done this for at least since the Jacobson case. And before that, predominantly, this has been a question protecting the health and safety of individuals and exercising this kind of power to force the individual to submit to a medical treatment has never, ever been something that has been authorized by Congress or done by an agency on an emergency basis.
Counsel, I don't mean to interrupt you, but we've never had a situation like this one before. It's unprecedented.
But I don't think in this case that justifies them co-opting a quintessential state police power. In fact, the opposite is true. It only points up the need to evaluate this in the larger context of whether Congress didn't do this, by the way. The Congress, just as recently as last summer, changed some of the discrete statutes specifically related to skilled nursing and nursing homes and authorized certain measures for strike teams to augment staff in those facilities due to COVID outbreaks, but they didn't authorize vaccines. So for staff, I think there are cues. There are cues in the statute. There are cues in the history and structure and the precedents of this court that support waiting and maintaining the status quo as the district court below did and the Fifth Circuit did.
Justice Thomas, anything further? Justice Breyer? Justice Alito? Anything further, Justice Sotomayor?
I just want to say the Sixth Circuit didn't, correct?
The Sixth Circuit in the OSHA case
I'm sorry, I
operated differently.
Yes.
Yes.
Justice Kagan? Justice Gorsuch? Kavanaugh? Justice Barrett? Okay. Thank you, counsel. Rebuttal, Mr. Fletcher?
Thank you, Mr. Chief Justice. Just 3 quick points. I'd like to start with the interpretation of the statutes before you that the other side is offering, because I don't hear them to contest that the Secretary's authority to set conditions for participating in the federal Medicare and Medicaid programs includes the authority to protect patient health and safety, even in the statutes that don't include that language. I don't hear them to be disputing that the Secretary can adopt infection control mechanisms or require people to wear gloves or do other things of that nature. Instead, their submission seems to be that vaccines are different. And I think the problem with that is that they haven't really given you a basis to ground that in the statute. The first thing that they've said is vaccination is typically the prerogative of the states. And of course, that's true in some sense, but we're talking here about a federal spending program. And the regulation of medicine is typically the prerogative of the states. Usually it's the states who require hospitals to make sure their employees wear gloves, or they follow the fire code, or they have sprinklers, things like that. But no one disputes that Congress has given the Secretary the authority to make sure that providers who are providing care under the aegis of the federal Medicare and Medicaid program live up to standards set by the Secretary. That's what the Secretary has done here. The other thing that I've heard them say about why vaccines are different is that you can't take them off, that vaccines are somehow different than gloves or other safety measures, and so some special specific authorization ought to be required. And I just don't think that can be squared with the context of the healthcare industry. Vaccination requirements are common throughout our society. They're particularly common for healthcare workers. They've been adopted voluntarily by providers around the country. You have virtually the uniform view of the medical community telling you that this is the best way to protect patient health and safety. If anything, I think it would be bizarre to say that the Secretary's authority to protect the health and safety of Medicare and Medicaid patients does not include the authority to adopt a measure that you see other regulators adopting, the medical community urging, and other providers adopting voluntarily. The whole point of the statute is to let the Secretary make sure that the standards of care for Medicare care and Medicaid patients meet best practices, and that's what he's done here. The second point I want to make, Justice Barrett, goes back to the colloquy that you and I had earlier about some of the different statutes. I hope we persuaded you that we're right about all of them, but in case we have not, I just want to make the case that it actually is worth the candle in this stay posture to go provision by provision. So as we explained, 97% of the employees affected by this regulation are covered by statutes that include the express health and safety language. Even if you just narrow it down beyond that, three categories, the largest three categories of providers, hospitals, home health agencies, and long-term care facilities, account for more than 90% of the covered workers. This is shown at the table at page 61,603. All of those provisions have express health and safety language of the sort that we've been discussing, and two of them, long-term care facilities or nursing homes and home health providers, actually include the extra provisions that we cite at page 6 of our reply that says the Secretary has not just the authority to ensure health and safety, but also the duty to do so. And I think at an absolute minimum, it's worth letting the rule go into effect as to them. And finally, Justice Breyer, I want to come back to a point that you've raised a few times about the equities because we are here on a stay. And I think a couple of observations to make about the equities. The first is a point that Justice Kavanaugh.
Ja, meine Lieben, ich will mich mal wieder zu Wort melden. Die Sache scheint jetzt in eine sehr schwierige Richtung zu gehen. Denn die Richter sagen, dass die Situation im Moment so kritisch ist, wie man sie in der Geschichte Amerikas noch nie gesehen hat und dass Ausnahmeregeln und Ausnahmemaßnahmen angebracht sind. Man verteidigt zumindest von zwei Richtern jetzt, Solido und Kavanaugh, De Soto und Solido sind jetzt zwei von den Richtern, die sagen, dass der Staat die Pflicht hat, das Leben und die Gesundheit des Einzelnen zu beschützen und dass das Ausnahmemaßnahmen, Regeln sich scheinen in diese Richtung zu gehen, so wie sich mir das anhört. Also wir wollen mal sehen, wie es jetzt weitergeht. Aber es ist eine hochkomplizierte Debatte. Und mal sehen, wie es weitergeht. Ja. Ich wollte mich da nur kurz einschalten und euch das sagen, in welche Richtung das geht. Also es wird hier diskutiert, dass das eine absolute Ausnahme- und Notsituation ist. Und eben dieselben Argumente, die wir auch von Deutschland kennen, die nicht anders sind. Ja, meine Lieben, das Gericht setzt jetzt aus, es zieht sich zurück bis zum nächsten Montag und dann wird es weitergehen, aber ich habe keine Einzelheiten, ich weiß die Uhrzeit nicht. Ich werde mich jedenfalls darum kümmern und vor allen Dingen, was ich euch versprechen werde, ich werde mich jetzt mal bei den Experten umschauen in Amerika, in den verschiedenen Medien, was die zu sagen haben zu der Debatte, die wir heute gesehen haben, die ja nicht so sehr lange war. Das war ja eigentlich erst eine Eröffnungsdebatte. Also, ich wünsche euch alles Gute, meine Lieben. Ich melde mich wieder zeitnah